So today we'll continue with our discussions in the pain management and the opioid series. The topic today is mood alterations and rewarding properties of opioids. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more discussion here. So today we'll continue with our discussions in the DEA requirements for the pain management and the opioid series. The topic today is mood alterations and rewarding behavior or rewarding properties of opioids. The main reference book that I've used is Goodman-Gilman, 13th edition. But there are some other studies as well that I have used, and I would actually give you a quick glance of those studies too. So let's start. I'm going to start sharing my screen. So mood alterations and rewarding properties of the opioids, the objectives for the talk today. And for the CME disclaimer, I have no conflict of interest to report. The objectives of the talk today are, number one, review of the mesolimbic dopamine circuit. This is the heart of this discussion today. Then the effects of opioids on nucleus accumbens, which is part of this mesolimbic dopamine system. Then review of GABA inhibitory system in mesolimbic system. So within the mesolimbic system, there is a GABA interneuronal inhibitory system, and I'll explain that, which is also related to dopamine or opioid behavior. Then review of effects of opioids on GABA releasing interneurons. And finally, understanding what is the rewarding behavior and what is the reinforcement behavior. Now, for references, just very quickly, this is the Kindle, and here we have mood alterations and rewarding properties, and this is Goodman-Gilman. So after this, the other references that I want to just quickly show us here. This one is ventral pallidum, cellular and pathway specificity in drug seeking. So this is one of the studies or articles that I'll use. This is another one. This is in Science Direct, ventral pallidum and alcohol addiction. My main reason for using this was for its connectivity. Then this is in the Pain Journal, mesolimbic dopamine signaling in acute and chronic pain, implications for motivation, analgesia, and addiction. This discussion that I'm going to do today is not an exhaustive review of this study. However, I have taken some parts from this study that I would show it to you. Then some diagrams and other references here from Wikipedia. And finally, one more study. This is mechanisms underlying delta and mu opioid receptor agonist induce increase in extracellular dopamine levels in the nucleus accumbens of freely moving rats. So this is a beautiful study as well. What they did was they went into the detail of the receptors present on various neurons in the mesolimbic system. And when these receptors are affected or when the ligand, opioid-like agonist ligands bind with those receptors, then they have done the discussion that what is the internal mechanism that happens. Now, I'm not going to go into that detail of internal mechanisms within the cell. However, we'll be able to use some of the knowledge that is here. So with this, I'm going to close all these references and come back here and start our discussion. So first of all, let's clarify opioid reward versus opioid reinforcement. You can think of the discussion today in actually two parts. One part is to try to understand what is the opioid's rewarding properties and what mechanism is involved for that. And the second part of the talk is what are the opioid reinforcement properties, what is that, and what is the mechanism involved in reinforcement. So first of all, this is my writing, opioid reward or hedonic experience. Hedonic is liking something. This refers to the immediate pleasurable and euphoric effects of opioids. So imagine if you eat dessert, that sweet dessert and that immediate pleasure that you receive from that, that is similar, this is a good example to say that when somebody takes opioids, there is an immediate effect on our brain, which results in the euphoria that the person feels. So that is immediate. This is reward or rewarding property of opioid. Immediate pleasurable and euphoric effect of opioid, primarily due to their activation of mesocorticolimbic dopamine system, and we would discuss this. So please, throughout this talk, if you can keep in your mind that rewarding properties are because of the activation of mesocorticolimbic dopamine system, and in that, if I can further refine it to say dopamine release in nucleus accumbens. So we'll discuss this. I have the drawings further down. So this includes the feelings of intense joy, relaxation, and contentment. This is a transient effect. This would not last very long. This is just like you ate dessert and you felt happy, and that's about it. That feeling goes away. And this doesn't necessarily produce drive. This doesn't mean that if you ate dessert today, then you want to have dessert again, although for some of us, that is actually a drive as well. But it is a transient feeling. The rewarding property is transient pleasure, euphoria. On the other hand, the reinforcement is the motivational drive. It's not just a transient happiness. Instead of that, the reinforcement of the opioid or the reinforcement behavior because of opioid means that a person who uses opioids wants to use opioids again. The difference, another very subtle difference between them. And I'm going to give the example of the desserts once more. Eating dessert to have that sweet feeling or euphoria is the rewarding property. On the other hand, imagine if you have headache. There is a negative feeling here, headache. You are not comfortable, you have headache. And you say, you know what, maybe eating sweets will subside that. Maybe I should eat dessert. So now you're not eating dessert because it is sweet and it is pleasurable. Instead, you're eating dessert because it is a negative feeling. It is a headache. And to avoid that, to be averse to that, you are then looking for, let's say, opioids, in this case, dessert. So the reinforcement is where we have some negative effects because of lack of opioid, and then we seek or want opioids to get rid of those effects. So I hope that this subtle difference is clear. The other thing is, so let me just quickly read it. This refers to the powerful urge to seek and take the drug again, even in the absence of immediate pleasure. So even when the effect is actually reduced, it's driven by the drug's ability to alleviate withdrawal symptoms and negative effect, creating a strong negative reinforcement loop. Then this is a long-lasting effect. Opioid cause significant change in neuronal circuits, particularly in the reward system, leading to tolerance and dependence. This persistent craving for the drug is the hallmark reinforcement. Then it is a compulsive behavior. Reinforcement can override rational decision making, leading to behaviors like compulsive drug seeking despite negative consequences in a personal or professional life. So that is the reinforcement. Again, today we're going to talk about the rewarding properties and how that circuit works, and the reinforcement properties and how does that circuit works. And they are overlapping circuits. So you'll have to keep an eye on it, that how they are different from each other. Now, the first thing to note is that the reinforcement mechanism and the analgesia and rewarding mechanisms and even the dependence mechanisms, they are not entirely isolated. They're not entirely separated from each other. They are overlapping. Even their neuronal circuitry, you would see, are actually overlapping circuitries. Number one. Number two, we are still not entirely clear that what is the exact mechanism of rewarding properties or reinforcement properties. And in this, I want to also add one more point here, and that is it was thought that dopamine release or dopaminergic neuron activation was behind the rewarding properties or the pleasure or the euphoria produced by opioids. However, the latest research does not support that it is only the dopamine release that can cause reward. Actually, dopamine release in some cases can actually cause lack of reward. So there is a prefrontal cortex's involvement as well. There is limbic system's involvement. There is mesencephalon's involvement, and brain strikes a balance. What are the exact mechanics in those areas? We are actually not very clear. So dopamine, traditional discussion, imagine if I had not read the latest studies, I would have said, very simply said as well, that dopaminergic neurons are responsible for euphoria, or dopamine release is responsible. But the actual fact so far that we know, there are so many still unclear areas, is much more different. Because of this, I want to first go over a more recent study which discusses this issue, and then we'll look at the mechanism. So let's go here. This is the study in pain, as I showed you. This is 2016, June. And I want to read some parts of it, just this much. This is an important time. The essence of this discussion, this part, is to present to you that the dopamine release is not just a rewarding behavior. It could actually be the opposite too. So there is a balance, and we are not very clear how does this exactly work. So the mesolimbic dopamine system, which I still have to explain what mesolimbic system is. So please go with me for the time being. The mesolimbic dopamine system comprises neurons in the ventral tegmental area and substantia nigra. So in our mesencephalon, that is in our brainstem, so we have brain, and then we have thalami and the basal ganglia, and then below that we have brainstem. One part of the brainstem is called mesencephalon or midbrain. These nuclei are present in the midbrain or mesencephalon, tegmental area, and substantia nigra. And we talked about it in the last discussion, what this area is, ventral tegmental area. So these project to ventral striatum. So again, yes, another area. This system was originally described to mediate pleasure and goal-directed movement associated with rewarding stimuli. So this mesocortical limbic system was originally described as goal-related rewarding system. However, it is now clear that dopamine, although crucial for reward processing, drives not the hedonic experience of reward, that is liking. This is an important sentence. Maybe the whole thing's core sentence is this one. It is now clear that dopamine, although crucial for reward processing, drives not the hedonic experience of reward or liking, but rather the instrumental behavior of reward-driven actions or wanting. Phasic dopamine acts, phasic mean increasing and reducing in phases. Phasic dopamine acts as an incentive salient signal underlying reinforcement learning. So see, now they went from rewarding to the reinforcement as well. Moreover, averse stimuli, where you avoid something, averse stimuli such as pain also stimulate dopamine. And this is one of the aspects of the rewarding and then reinforcement. The reinforcement part is also driven by the pain management effect of the dopamine or opioids. Because opioids reduce pain, then that becomes an additional factor in us trying to seek opioids. So moreover, averse stimuli such as pain also stimulate dopamine, further diminishing the idea of dopamine as a reward signal. So now here they're talking about dopamine and discussing that is it the dopamine which is the reward signal? And they're saying that even pain stimulates dopamine. Now, pain stimulating dopamine should not be a reward. You shouldn't say, all right, I have pain, so I have dopamine, and well, that is rewarding. No, so there is a balancing act that is happening. Recent studies suggest that dopamine neurons in the VTA, ventral tegmental area, and SN, substantia nigra, form a heterogeneous population tuned to either or both aversive or rewarding stimuli. So I think this is the core to take away, that as much as you would read in the books, as much as you would read in the text, that dopamine system is primarily responsible for rewarding, what you would also see in the latest studies is pain can actually cause dopamine release too, and that is not a rewarding stimulus. So there is some balance there. Then in their conclusion, they say, we no longer equate dopamine release with pleasure or reward, but rather acknowledge that dopamine neurons are heterogeneous population of neurons that respond to both appetitive and aversive stimuli. Appetitive, that towards or seeking behavior, and aversive is avoiding behavior to mediate motivational behavior. So that means dopamine neurons can cause demotivation and they can cause motivation. It depends what is the overall bigger context in which these are operating. Release of dopamine after an acute painful stimulus acts as a salience cue and is critical for approach or avoidance behavior. So now we are releasing dopamine after pain, but that behavior, the result of that will be avoidance of pain. On the other hand, you take opioid and that also increases dopamine, but that produces a rewarding behavior and you seek for it. So now you can't blame the same dopamine neuronal system to say this caused the rewarding outcomes. The same dopaminergic release can actually cause avoidance too. So there is a bigger mechanism at play, which we are not very much clear. The story becomes more nuanced when accessing motivated behavior towards opioid in chronic pain. Research shows that the ability of opioids to stimulate the mesolimbic dopamine system is impaired. So now they're talking about something else. We have been talking that the euphoria produced by opioid is by increasing the dopamine release in this mesolimbic pathway. Now they're talking about research shows that the ability of opioids to stimulate the mesolimbic dopamine system is impaired, and this seems to translate into reduced responsiveness to appetitive stimuli. However, opioids maintain their reinforcement in subjects with chronic pain through their analgesic properties. So now I am adding one more dimension. I talked about it. The reinforcement, seeking the opioids due to some negative signals in our mind, in our body. One of that is pain alleviation. So patients who are using opioids because of pain, they would have reinforcement because of pain as well, and not only the central circuit changes too. So I hope that the context of the discussion is clear. Now we're going to look at the mechanisms that have been described here. So first of all, what were they talking about when they said mesocorticolimbic pathway? So I'm going to start from here. Let me increase the size of this one. This area, this is the brain stem. So imagine within our skull, somewhere starting at the base of the skull and going downwards before the spinal cord, there is an area of the brain that is called the brainstem. One part of the brainstem is the mesencephalon. Mesencephalon, as I discussed last time, have periaqueductal gray matter, or we have ventral tegmental area, plus we have substantia nigra. And I have discussed that in the previous discussion as well, that substantia nigra simply means interspersed gray matter with white matter. So it kind of, plus this one specially, that is reticular formation, I'm sorry. This one specially, this looks black when you look at it under the microscope. So we call it substantia nigra, an area that is black. This ventral tegmental area, this is the primary pleasure engine in our system. So if I simplify it, of course, if you go into neurosciences and go deeper, this statement that I'm going to say is a very simplified statement and needs a lot of further details to it. But if I simplify it, the pleasure engine in our brain is ventral tegmental area in the mesencephalon. That is where the pleasure will be driven from, the signals. So what happens? From the ventral tegmental area and substantia nigra in mesencephalon, there are connections that go to limbic system. So that is the mesocorticolimbic dopamine pathway, or mesolimbic pathway. Remember mesencephalon, limbic, this is the limbic system, or the emotion management system, reward system, memory system. So from the mesencephalon, meso, going to the limbic system, limbic, mesolimbic, and releasing dopamine, mesolimbic dopamine system. Now, not the whole of the limbic system, but what parts of the limbic system, especially the nucleus accumbens, which is a nucleus that is part of the limbic system, and olfactory, tubercle olfactory area. These are the two areas where the reward pathways lead to, or neurons starting from here and here. And not only that, these neurons are releasing dopamine here. So now I want to sensitize you for one more thing. That is, in this area, the nucleus accumbens, this red one, in this area, not only there are neurons that come in here and release dopamine, somehow this area has its own neurons that can release local dopamine as well. So there are external neurons coming in and relaying here and releasing dopamine, but there are internal neurons here as well that can release dopamine as well. And this will become an important thing to keep in mind as we look more into these mechanisms. Okay, so our pleasure engine, ventral tegmental area, or VTA, sends neurons to nucleus accumbens in the limbic system. It actually sends neurons to the prefrontal cortex as well. What does that mean? So let's say you're doing something that would give you pleasure. Let's say you're eating dessert. This ventral tegmental area will send a message to the nucleus accumbens in the limbic system to say, hey, become happy, or create the feeling of happy in this person. It would also send messages to prefrontal cortex as well, which is our brain's personality area. I mean, again, in a high, crude way. And it would tell the personality area as well that, hey, we're going to become happy. And personality or prefrontal area would then in turn also send signals back to nucleus accumbens to say, okay, yeah, sure, become happy, or maybe not become happy. This is, for example, let's say you're in a social setting where there is a thought in your mind or you observed something that actually made you laugh or happy, but the setting is such that you cannot laugh. Maybe you're sitting in an event where people are sad and you observed a child doing something that kind of made you laugh, but you are going to control that. So what happens is whenever the pleasure feeling is produced and sent to the nucleus accumbens to actually feel that pleasure, at the same time, the prefrontal cortex or personality areas are also told that, hey, we're going to feel pleasure. And personality area in turn can then modulate this behavior. Okay, so staying with this much, this is mesolimbic dopamine system. Nucleus accumbens is the actual reward system nucleus. Nucleus accumbens, this one, in turn sends messages and receives messages to many parts of the brain. One of those parts is the ventral pallidum. It is another nucleus that is part of the basal ganglia, ventral pallidum. Ventral pallidum has neurons that would also do connectivity throughout the brain, and this would release neurotransmitters in the brain tissues to finally feel the euphoria and happiness. So the engine that drove the happiness is ventral tegmental area in the mesencephalon. It sent the message to say, all right, limbic system, you should start feeling happy. It would send that message to nucleus accumbens, and dopamine will be released there, and olfactory area. Then there are many outgoing connections and ingoing connections here. One of that area that will be connected is the ventral pallidum. Once ventral pallidum becomes activated, then we will feel happiness. We will feel euphoria. So that means all the other signals will be then integrated back, and they will say, yeah, you're in a setting that you can laugh. So maybe you're sitting with your friends and they told a joke, and totally correct setting socially that you can laugh. And then so finally ventral pallidum would say, okay, let's become happy and let's laugh and let's giggle and be happy in whatever way we will. So this is the mesolimbic dopamine system. So after this, I'm going to present to you a part that would not be presented in many of these kind of topics. And that is opioids directly can affect the nucleus accumbens to produce the feeling of euphoria or reward. So if I go back here for a second, we said in this diagram that the pleasure signal starts from the ventral tegmental area, and that is going to activate the nucleus accumbens by releasing dopamines over there. Now we are saying something else as well. And what we are saying is, if we directly inject, and that's what they did in this study that I'm showing you, if we directly inject opioids here in this area, we do not do anything to the ventral tegmental area. Ventral tegmental area is not activated. So ideally, there should not be a dopamine release here. But if you directly inject opioid here in the nucleus accumbens, then the neurons here can produce dopamine and release it. They measured extracellular dopamine to be present here because of opioids. So that means opioids have some direct effect on nucleus accumbens as well. And as you would see a little later, opioids were thought to have an effect through this mesolimbic pathway. If you watch videos or if you read other books, you would always see that when we talk about opioids, we'll say that, hey, under the influence of opioids, the VTA will do some modulation of nucleus accumbens and will feel euphoria. However, please realize it's not necessary to activate the system if opioids are directly infused in nucleus accumbens. Nucleus accumbens, in reaction to that, will produce dopamine, and then the remaining euphoria signals would go on. That means, what does this mean? What this means is that in the nucleus accumbens are the opioid receptors present here that directly respond to opioid to produce euphoria. Okay, so now that means you have two target areas. Opioids do work here, we know this, that opioids, when given, will work on the VTA, which will then cause this pathway to become activated, and opioids can directly work on nucleus accumbens as well. So I want to quickly read this one part as well. So mechanism underlying delta and mu opioid receptor agonist induce increase in extracellular dopamine levels in the nucleus accumbens of freely moving rats. So here they talked about, I'm not going to read this whole thing, just a part of it. The nucleus accumbens is a terminal area of the mesolimbic dopaminergic system that arises in the ventral tegmental area. Opioids are thought to enhance dopaminergic activity in the nucleus accumbens by activating delta and mu opioid receptors in the ventral tegmental area. What he's saying is that we know that this is ventral tegmental area, this is nucleus accumbens. It is thought that the ventral tegmental area, when we have opioids here, it causes dopamine release here. This is known. You know, and I know that. This is the ventral tegmental area. It is sending messages here to the nucleus accumbens, and these would cause dopamine release, and that would cause euphoria. However, here they're saying that there are receptors here directly as well, which will cause euphoria. So let's read. The nucleus accumbens is a terminal area of the mesolimbic dopaminergic system that arises in the ventral tegmental area. Opioids are thought to enhance the dopaminergic activity in the nucleus accumbens by activating delta and mu opioid receptors in the ventral tegmental area. However, delta and mu opioid receptor agonists increase extracellular levels of accumbal dopamine when infused directly into the nucleus accumbens of rats. So I think I've kind of repeated this a lot of time. Two effects, and I'm going to leave the rest of this. I have the link to this paper. You can then look into that by yourself. Okay, so now I'm going to disentangle the two pathways, rewarding pathway or reward producing pathway, and then the reinforcement pathway. So let's look at them. We have already seen the reward producing pathway. So this is the ventral tegmental area. This is the substantia nigra. This is the nucleus accumbens, and this is the mesolimbic pathway. Good. That was the reward system. So if somebody said to you that after this lecture, how do you think rewarding property will appear or will happen from opioids? The answer is twofold or two possible mechanisms. I think the complete answer is going to be, we are not entirely sure, number one. Number two possible mechanisms. One is their ventral tegmental area has opioid receptors, which the neurons become activated under the influence of opioid, release dopamine in the nucleus accumbens and cause euphoria. The second is, and mind you, that the nucleus accumbens also has receptors for opioids in its neurons. So if you directly put opioids on the nucleus accumbens without stimulating the ventral tegmental area, even then euphoria can be produced because dopamine is released in nucleus accumbens with direct effect of opioids on it. So that closes the topic of how rewarding behavior is produced by opioids. This is temporary. This phases out very fast. Within minutes, that euphoria occurs and goes away. And it is not necessary that always dopamine release is necessary for the reward. As you saw above, dopamine release increases even with pain, which should not be a rewarding mechanism. Now we're going to go to the second part of the talk, and that is reinforcement mechanism. Reinforcement, remember, seeking the opioids because be averse or we want to avert some negative feeling, the withdrawal symptoms. So how does reinforcement work? So for reinforcement, what we have to understand is where the opioid receptors present. So once again, please look at this diagram. This is the ventral tegmental area. So just to connect in your mind the diagrams, this is ventral tegmental area. Here in this diagram, this is ventral tegmental neuron. Then in this diagram, this was the nucleus accumbens here. In this diagram, this area is nucleus accumbens. Then in this diagram, this part was the ventral pallidum. Here, this little neuron that is lying down here is the ventral pallidum. Originally, we discussed this, that ventral tegmental area sends signals to the nucleus accumbens, which in turn works with the ventral pallidum, plus many, many other systems. So first here in this diagram that we should become aware of is the following. There are mu dopamine receptors present on GABAergic neurons or GABA releasing neurons, on the nucleus accumbens interneurons, nucleus accumbens, that one that would actually start producing reward feeling. There are opioid receptors on these neurons, not only on the postsynaptic part, but also at the release site or the presynaptic axon terminal as well. So why is this important? So if somebody said, we are talking reinforcement, we're not talking reward. Reward is a different effect. We have already handled that. If somebody said for reinforcement, what mechanisms come into play, reinforcement of opioid? Your answer will be, well, there are mu receptors that are present within the mesocorticolimbic pathways. Those receptors are present in the GABAergic neurons, in the nucleus accumbens, and postsynaptic here and presynaptic here neurons. Now the question is, how does this circuit work? What this wiring does? So let's look at the normal behavior of this wiring. Usually what happens, or normally what happens, and in this case, normally is without the opioid. You and me, we don't have opioid in our system. What is going on? What happens is dopamine or dopaminergic receptors present in the ventral tegmental area. Did I say dopaminergic receptors? Dopaminergic neurons present in the ventral tegmental area will have their axons relay on nucleus accumbens neurons. We know this previously as well. These neurons will release dopamine on the nucleus accumbens neurons. When the dopamine is released on these neurons, nucleus accumbens neurons, these neurons would then release GABA, gamma aminobutyric acid, GABA on the ventral pallidum neurons. So you release dopamine, which in turn caused the neurons in the NAC to release GABA on ventral pallidum. GABA is an inhibitory neurotransmitter, and it would cause the ventral pallidum neurons to become inhibited. When the ventral pallidum is inhibited, then the feeling of reward will not occur. Good. Do you see the difference of this circuit from the previous reward circuit? The difference is, we were saying in the previous circuit that ventral tegmental neurons release dopamine here, and somehow the NSC area under the influence of dopamine causes this ventral pallidum to become activated. That was a different system. Although they are overlapping mechanisms, they are overlapping circuits. And this is why sometimes students become confused that, hey, you're talking about the same circuit. But yes, we're talking about the same circuit, but two different behaviors. So that means they are similar connections, but they have dissimilar outcomes. In the previous one, in the rewarding behavior one, we said dopamine releasing neurons will cause the nucleus accumbens to become activated, and that in turn would create rewarding behavior or pleasure. Here we are saying is, normally dopaminergic neurons will cause activation of GABAergic neurons in the nucleus accumbens, which would cause GABA release on ventral pallidum. That would cause ventral pallidum to become inhibited. That would reduce the feeling of pleasure. Now, we already know the mu receptors presence here. We did that in the last diagram. So this is the last diagram for the talk today. Now imagine opioid is introduced. So what I would request you to keep in mind, opioid is introduced in the system, and there are going to be two effects: rewarding system or pleasure versus the reinforcement. Pleasure was that opioid caused increase in dopamine release, which caused pleasure to occur or euphoria to happen, intense pleasure to happen. Here we are seeing a very different effect. Same circuit. I shouldn't say same circuit because one circuit doesn't do two things. Same network, but different behavior. What is that behavior? When opioid is introduced, opioid causes the ventral tegmental area neurons to become inhibited. So if you see here, this little GABA neuron has opioid mu receptor on it. which causes less neurotransmission here, which causes dopamine releasing neurons in ventral tegmental area to not become activated. When they are not activated, that causes the neurons present in the nucleus accumbens of GABA releasing neurons, they will now become inhibited as well, directly because of lack of transmission here, plus also because these neurons in nucleus accumbens have opioid receptors on them. And when the opioid is acting on them, it is going to cause hyperpolarization of these neurons. So these neurons would switch off. When these neurons will switch off, then they will not release GABA on the ventral pallidum. When ventral pallidum doesn't have GABA released on it, it is not inhibited anymore. And the ventral pallidum would start firing, and that would create reward. And this is the mechanism behind reinforcement. So in the reinforcement, the dopamine release is actually reduced in this system. In the rewarding behavior, dopamine release is actually increased. Now, what happens is, this is my conjecture, I could be incorrect. What happens is that as the opioid is introduced in this system, imagine that there are two kinds of neurons. One neurons are the ones that start producing dopamine, and other neurons are these ones that were producing GABA. Opioids acting on GABA will cause suppression of GABA. On the other hand, the other neurons that were producing dopamine, opioids to become more active, which would then cause this ventral pallidum to be active, and the feeling of reward would occur. So this is the underlying mechanism for reinforcement. When this mechanism runs again and again and again, the ventral pallidum is connected with the remaining brain tissues. The nucleus accumbens is connected there as well. The mesencephalic pathways are connected to the cortical areas and other areas too. All of those things then work together to create a final output of behavior for a person. So this is the discussion. We have mesolimbic pathway, where we have ventral tegmental area in the mesencephalon, which is connected to nucleus accumbens and olfactory nodule. Nucleus accumbens in turn is connected with ventral pallidum. Mesencephalic ventral tegmental area is the engine for producing pleasure. That would cause nucleus accumbens to have dopamine in it. It would release dopamine there. That dopamine would cause nucleus accumbens to further then activate nucleus pallidum, and will feel euphoria. And opioids can work directly on the ventral tegmental neurons to activate the system. They can work directly on the nucleus accumbens neurons and activate dopamine release and then ventral pallidum and cause euphoria. On the other hand, for reinforcement, there is another circuit running in the same system, but the neurons are doing slightly different behavior. So ventral tegmental area is sending dopaminergic neurons to the nucleus accumbens. Nucleus accumbens in turn, now we're talking about GABAergic neurons there. GABAergic neurons in turn are connecting to ventral pallidum and suppressing it by releasing GABA on it. And that is the normal behavior. Under the influence of opioids, the dopaminergic neurons from mesencephalon to nucleus accumbens become reduced, number one. Number two, there is a direct effect on the nucleus accumbens as well, where the GABAergic neurons are also suppressed or inhibited. That causes the dopamine releasing neurons to freely release dopamine on the ventral pallidum nuclei, and they can then produce reinforcing behavior as well.